Good morning, Minister Allen. Thank you so much. I don't know if I'm the subject matter expert, but I do try to bring you current information. So today, my topic is going to be on something that many of you may not realize that it is a national crisis, and that is antibiotic resistance. And so it's important that we're educated on the use and what antibiotics is used for, so that we're not abusing it and developing resistance to these type of medications. So what are antibiotics and what are the common concerns about antibiotics use? So antibiotics are medications that stop bacterial infections from growing. Bacterial infections are microscopic germs that live inside your body, on your skin, and all around you. While most types of bacteria won't hurt you, some types, like some in your gut or on your skin, help keep you healthy. However, certain bacteria can make you sick, with the effects of ranging from mild infection to severe, one that lands you in the hospital. Currently, antibiotic resistance is one of the most urgent threats to the public's health. Antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. Now, more than 2.8 million antibiotic-resistant infections occur here in the United States alone every year, and more than 35,000 people die as a result. So what are the benefits of antibiotics? Antibiotics have many benefits. They can successfully clear bacterial infections from your body, ease your symptoms and help you feel better, speed up your recovery, stop you from spreading an infection to others, and protect you from serious illness or complications. And it can also save your life. Possible side effects, however, are common ones, like diarrhea, nausea and vomiting, dizziness, rash, yeast infection. Some serious side effects can be like C. diff, allergic reactions, some of which may be severe or life-threatening, like anaphylaxis. Be sure to read the instructions and warning that come with your antibiotics. Learn all possible side effects and the signs of an allergic reaction. And you want to contact your healthcare provider if you have side effects or any questions or concerns. Other possible side effects. Allergic reactions to antibiotics aren't common, but they can happen and range from mild to severe. On the mild end, you might have itchy rash, the hives. More severe, blistering of your skin, swelling of your face, lips, tongue, or throat, which is an anaphylactic reaction. Breathing problems, including wheezing. Again, you want to call your provider to make sure that you discuss any side effects you're having. Whether it's diarrhea or the rash, you want to discuss those. And here in America, we call 911, our local emergency. I know in Jamaica is 119 if the symptoms are severe. So what forms does antibiotics come in? They come in the oral form, topical form, and the injection forms. And your doctor will determine which one is best. Sometimes we buy the over the counter. If we have a cut, like minor cuts, that's okay. So when will antibiotic not work and is not needed? Antibiotics do not work on viruses, such as those that cause colds and runny nose, even if the mucus is thick, yellow or green. Most sore throats, except for strep throat, flu, most cases of chest colds. Antibiotics are not needed for some common bacterial infections, including many sinus infections and some ear infections. I know some people might think differently, but for some of those, you really don't need it. Taking antibiotics when they're not needed won't help you, and their side effects can still cause harm. Your doctor can decide the best treatment for you when you're sick. Never pressure your doctor to prescribe an antibiotic. A lot of people do that and don't do that. Of note, we all want to feel better instantly when sickness strikes, but viruses, not bacteria, are the culprits in many common infections like colds and flu. No matter how awful your symptoms are, taking antibiotics for a cold simply won't work. It's like putting a bandage on sunburn or rubbing aloe on a paper cut. The fix doesn't match the problem. It won't help, and it might even make things worse. Talk to your healthcare provider anytime you have questions or concerns about treatments, including antibiotics. They can help explain why you need or don't need certain medicines and how best to care for yourself at home. You need a prescription from a healthcare provider to legally get oral antibiotics. This is for your safety and protection. A prescription makes you make sure you receive the correct medication for your infection and one that is safe for you based on your medical history. You can get some forms of topical antibiotics like those that treat minor skin cuts over the counter, as I just discussed. Of note again, do not share your antibiotics with others. That's how a lot of people get into problems. Do not save them for later. You want to talk to your pharmacist about safely discarding leftover medicines. Do not take antibiotics prescribed for someone else. This may delay the best treatment for you, make you even sicker, or cause side effects. When it comes to antibiotics, it's possible to have too much of a good thing. Using antibiotics when they are not needed, like for viral infections or mild bacterial infections that would go away on their own, can lead to unnecessary side effects and contribute to the global problem of antibiotic resistance. The overuse of antibiotics, especially taking antibiotics when they are not the correct treatment, promotes antibiotic resistance, as I have discussed and continue to say that. According to the CDC, about 1/3 of antibiotic use in people is not needed, nor is it appropriate. When taking antibiotics, be careful with grapefruit and citrus juices, and wait at least 3 hours after taking your prescription before consuming dairy products. These products can interact with antibiotics and affect how your body absorbs them. If you take other medicines, ask your doctor if it is safe to take other medications or supplements with your antibiotics to avoid harmful interactions. I hope this was helpful. I want to give special acknowledgments to St. Luke's Hospital, the CDC, Mayo Clinic, and Cleveland Clinic for the information that I provided you today. If you have any questions, please join us in the Zoom room immediately after service, and I'll be happy to answer those questions for you. Again, remember, don't share your antibiotics and don't pressure your provider to get prescriptions to get antibiotics. Have a great day. God bless.